should add is that quality of life.
Yeah.
If you've got no saliva in your mouth, you can't speak properly, you can't go out and socialize properly, and you take ages to eat your food. So it is a real effect on your whole quality of life. So big problem.
And how are we going to help patients who've got dry mouth?
So when you have no salivary glands that work, so when you've had radiotherapy to your salivary glands, which are here, and then you have minor ones inside your mouth, then really the only way of improving the saliva in your mouth is to have either water or artificial saliva substitutes. Neither of them are great because the water just washes through too quickly. It doesn't have the mucins in it to have the lubricant effect. The salivary replacements, they just don't stay around in your mouth long enough. So it's really hard for those types of patients, and they end up with ulceration, they end up with soreness, and it just is very depressing for people long term.
So when we developed Dr. Heff's, we had these patients in our sights, as it were, to try and help them. And I think genuinely, when I see patients, especially dry mouth patients, I've got 3 or 4 patients with Sjogren's, they've tried lots of things to try and aid the thing. And I think if we're honest, Dr. Heff's is probably not the silver bullet for everybody.
No.
But we'd recommend that people with dry mouth, even slightly dry mouths, start to use it, because saliva is massively important, not only for comfort, but for protection of the teeth and the gums, but also protection against dental diseases. So if we're going to have that saliva has been taken away, we would recommend Dr. Heff's, because that is going to help fighting those diseases, also trying to get a little bit of saliva going, that little bit that can be done to get going. And as we were talking about quality of life, you're going to be left with a really nice taste in your mouth. And as I say, it's not going to help everybody, but I think everyone should try it, because we've had some really good feedback from patients who've had, as you say, radiotherapy, chemotherapy and Sjogren's syndrome have all said that this has been beneficial to them.